Todd, let's hop on over to GW Pharmaceuticals. Really in some ways, kind of the opposite story, right? A big marijuana breakthrough for this cannabinoid company. Why don't you go ahead and give us the background?
This is a huge breakthrough, and I'm going to say that it's a much needed breakthrough.
Yeah.
If you go back to 2013, 2014, everybody was thinking medical marijuana is the wave of the future. You've got 23 states that have approved medical marijuana in possession in some form. You've got states like Colorado and California that allow dispensaries to dispense certain strains of marijuana that can be used to treat various maladies. You've got all of this momentum, yet there's still a big gap between the anecdotal evidence of marijuana helping patients and the scientifically proven evidence of marijuana helping patients.
Right. Which, of course, brings us through to this breakthrough.
Yeah. I mean, last year, GW Pharmaceuticals fell short on 3 very important trials that were studying marijuana's use in cancer pain. They also stumbled in a trial that was evaluating marijuana's use in schizophrenia patients. So it was very, very important to be able to show investors that and everybody in the community, all the marijuana advocates, that yes, you can take marijuana and marijuana can help in some indications. And what happened at GW Pharmaceuticals last week is they said, yes, we have shown in one phase 3, which is a late stage trial, that patients with a certain type of childhood onset epilepsy can see the number of seizures they suffer every month reduced significantly by 39% by taking a purified version of CBD, which is a cannabinoid that is found in the marijuana plant. So again, This isn't a test that's basically giving them marijuana and telling them to smoke it.
Right.
It's a medically derived therapy that's coming from the marijuana plant's chemical cannabinoids and being applied in this setting.
Yeah, and by comparison, folks receiving placebo only saw an 11% improvement in the number of seizures. So that's a pretty big difference. And there's a second trial readout in the second half of this year. And then they've got a number of other potential readouts in the coming years.
Yeah, epilepsy, especially childhood onset epilepsy like Dravet syndrome, which this trial was conducted in.
Right.
Lennox-Gastaut syndrome, sorry.
Say that 3 times fast.
Yeah,
right.
Those trials there's a significant unmet need. Okay, these are debilitating diseases for patients, and neither of these are very adequately controlled by existing anticonvulsants that are on the market. So, the thinking here is that if we succeed in the first Dravet syndrome trial, and we can put up good results in 2 other phase 3 trials in Lennox-Gastaut syndrome, then maybe we can file for FDA approval at some point, maybe by the end of this year. And if we have they have fast track status on the Dravet syndrome indication. So theoretically, you could have GW Pharmaceuticals launching its first marijuana-derived epilepsy drug in 2017.
In the U.S., yeah.
U.S.
Yeah, that would be potentially huge.